Hello, my name is Samantha Navas, and I'm pleased to present the findings on the impact of the Mediterranean diet on systolic blood pressure compared to a usual diet. The research focuses on exploring dietary interventions for hypertension management. To structure the investigation, I formulated the following PCOT question. Population, adults over the age of 40, with an intervention of Mediterranean diet compared to the usual diet, with an outcome of a decrease in systolic blood pressure by 3.0 over a 6-month period. Hypertension or high blood pressure is a major public health issue in the United States, affecting approximately 46% of adults, defined as having a blood pressure of 130 over 80 or higher. It significantly increases the risk of cardiovascular diseases. Current guidelines from the U.S. Preventative Services Task Force recommend that patients with cardiovascular risk factors receive counseling on a healthy diet and physical activity. The aim of this research was to determine if the use of a Mediterranean diet decreases systolic blood pressure in adults over the age of 40 compared to the usual diet over a period of 6 months. I used the Johns Hopkins EBP model to guide the research, which included identifying a clinical problem, conducting a search and appraisal of relevant research, and implementing and evaluating practice changes based on the findings. The literature search spanned from 2019 to 2024 across databases such as PubMed, Cochrane Database, and CENAL, using keywords such as hypertension, high blood pressure, Mediterranean diet, MedDiet, and usual diet. The search identified 6 significant studies. First, a high-quality RCT showed that after 1 year, participants following the Mediterranean diet had a significant reduction in systolic blood pressure compared to the control group. A second randomized control trial demonstrated that a 3-month Mediterranean diet intervention resulted in a greater reduction in systolic blood pressure compared to a usual diet, a salt-restricted diet, and the DASH diet. A systematic review with meta-analysis of 15 studies showed that the Mediterranean diet lowered systolic blood pressure by 3.1 and diastolic blood pressure by 1.6 compared to a usual diet. Another systematic review with meta-analysis indicated that dietary education and counseling led to a reduction in systolic blood pressure by 4.07 and a diastolic blood pressure of 2.64. A qualitative analysis highlighted barriers to recommending the Mediterranean diet, including limited knowledge among the clinicians and organizational challenges. Lastly, a clinical practice guideline from the U.S. Preventative Services Task Force emphasized the importance of counseling on healthy diet and physical activity for patients with elevated blood pressure. The consensus from these studies suggests that the Mediterranean diet is effective in reducing systolic blood pressure. The findings support the integration of the Mediterranean diet into clinical practice for hypertension management. Healthcare providers can confidently recommend the Mediterranean diet as a therapeutic approach for managing hypertension. To effectively implement this diet, further research and larger, longer-term randomized control trials are necessary. We must conduct more research, implement this research in clinical practice, and evaluate and make sure there is an improvement. In conclusion, the Mediterranean diet has a significant positive impact on reducing systolic blood pressure in adults. By incorporating this diet into clinical practice, we can improve cardiovascular health outcomes for patients with hypertension.